Manipur COVID-19 death toll rises to 11. Total positive cases stands at 3,466. India coronavirus numbers rise in recoveries, growth in active cases drop. And UCM opposes final Naga political settlement at cost of territorial boundary. A very good evening. Welcome to Times of Manipur. You're watching the Evening News Bulletin. I'm ALBINA RIAMEI giving you the latest news updates. 3 men infected with COVID-19 have died in the past 24 hours in Manipur. According to the COVID-19 Common Control Room, the 3 men, a 76 years old, a 28-year-old and a 68-year-old succumbed to the contagion. They all had comorbid health conditions. 2 of them died at the Jawaharlal Nehru Institute of Medical Sciences, JNIMS, Imphal. The COVID-19 death toll in the state has climbed to 11 as on Saturday. Meanwhile, the state also reported 84 new cases of COVID-19 from the general population, and 165 personnel of Central Armed Police Forces (CAPF) belonging to various districts were tested positive for the disease in the past 24 hours, taking the cumulative COVID tally to 3,466 with 1,530 active cases and 1,926 recovery cases till now. 21 persons were discharged from different COVID care facilities across the state after they tested negative for COVID-19. The Lema Pokpam Primary Health Center (PHC) under Nambol has been sealed after 5 of its doctors and 1 nurse were tested positive for COVID-19 yesterday. According to our Bishnupur correspondent, the patients have been shifted to different COVID care centers. Sources said the number of positive cases among the employees of the health center may go up. It may be mentioned that the doctors and nurses of the primary health center contracted the virus after a COVID-19 patient from Pukrambam got treatment at the PHC a few days back. In the last 24 hours, Noney district reported 4 COVID-19 cases. Among them, 2 are personnel of Noney police station, while 2 are personnel of 44 Assam Rifle COB, Khongsang and Nungba COB. They have travel history to Umroi. For the last 2 weeks, the growth in active cases of novel coronavirus in the country has been dropping at a fast rate. This happens when the recoveries and deaths rise at a rapid pace, a media report said today. Since deaths from only a small part, just about 2% of all the confirmed cases, the decline in growth rate of active cases can primarily be attributed to the rise in recoveries. While the total number of infections in the country is now more than 20.88 lakh, only about 6.19 lakh of these are currently sick. The rest have recovered, while a small number, about 2%, have died. While new infections are rising at a steady pace, the growth in the total number of infected cases has been on a decline again for the last 10 days. And the growth of active cases is declining even faster. At 3.03% per day, the current growth rate of total confirmed cases is already at an all-time low due to all the recoveries. The active cases usually always grows at a slower rate than the total confirmed cases. But around July 20, for a brief period, active cases had been growing faster than total confirmed cases. However, the decline after that has been swift. For the second consecutive day on Friday, India added more than 60,000 new cases. Maharashtra and Andhra Pradesh contributed over 10,000 cases each, while Tamil Nadu and Karnataka discovered around 6,000 cases each. 993 deaths were reported on Friday, the highest so far, taking the total number of people who have died due to the disease to over 42,500. United Committee Manipur UCM is concerned over the last leg of the over 2 decades old peace talks between the centre and NSC and IM expected to take place by August 15, 2020. The UCM is concerned that the final Naga political settlement could infringe upon the territorial integrity of Manipur. Through a press statement, UCM informed that the committee is closely watching the developments of the ongoing fresh round of peace talks between the centre and the NSC and IM leadership and NNPG groups, which started in New Delhi yesterday. UCM said a final settlement for the protracted peace talks is necessary, but not at the cost of territorial boundary of Manipur and other northeastern states. Meanwhile, social scientist Dr. Dhanabir Laishram has observed that formation of a territory within a territory or administrative divisions could spark fresh tension in Manipur. He was referring to the Naga peace talks. The centre resumed negotiations with NSC and IM leadership yesterday. Dr. Laishram also cautioned that tension may appear between different groups in the state due to the centre's efforts to persuade NSC and IM.
And they welcome peace also. Only the problem is the primary demands of this NSNIM, that is Greater Nagaland, and or creation of this new territory of the Naga inhabited area in Manipur, or separation of administration from Delhi. These are really protests by our people, continuously protesting. Our people deny such disintegration of Manipur and having separation of administration in between hill and the valley.
Now we have a short commercial break. Stay tuned for more updates.
Another feature single loina Lightare Dachan Ready Gold. Distinctive LED DRLS, 20-inch 32cm infotainment screen, smart drive auto, spacious cabin, flexible storage capacity, intuitive reverse parking assist camera, starting price 3 lakh. Booking kinama ngasi maglengsin birau Island Nissan Kanchipur near Standard Robert Higher Secondary School.
Downtown University, Chahi Manghan Biganu, Adomgi Ichabu, Chahi Manghan Biganu. Northeast India's most placement-driven university ama oiriba, Assam Downtown University ki admission haujare. Pandemic asigi yenglaga online class su September amadigi haujaragani. Engineering, Paramedical amadi allied course singda ming chanbining singna Assam Downtown University admission office Babupara Bosem Imphal lerak talak piduna form lobiyu ming chanbiyu amadi tanabiyu.
Welcome back. Manipur Pradesh Congress Committee MPCC Vice President and AICC member Moirangthem Hemanta today claimed that the Joint Committee on COVID-19 headed by Manipur Chief Minister N. Biren is a weak committee. Hemanta was speaking to media at Congress Bhavan in Imphal, where PCC Secretary Tilotama and General Secretary Administration Hareshwar Goswami were also present. Hemanta said that the BJP-led government in the state is working hard to combat the pandemic. However, the Joint Committee on COVID-19 will not help in fighting the virus, saying a cabinet subcommittee is needed for combating the virus. He added conducting a mass testing for COVID-19 in the state is the need of the hour.
Manipur Sarkar gi yam soiriba amana grassroots level da leiriba angalwadi workers sing asha sing supervisors sing panchayat ki pradhans members local bodies amatte involved to hunde masi makoi de involved to ragadi magi ward ta magi panchayat area da magi adu councilor na puriba jaga si da duty ji pithoga makoi da tawgadoni da honorarium da financial aid sing je kharga Pigadabri, Maduna Tabida, Pura Center, the Gimasta, Salaidana, immune system Kankal and Gadabaniana, loud and labors in the Koyar. Pandipaning Dabani, do Pandavayada Amati, Hiramatamda, Manipur Sakana, immune system Kankal and Gadabani Hadana, Kanala Yaragazu, Somda, Kobiti, Patientina, Sapuk, and the Sabangam, Drena Lauribaze, Pochimasao, Jergazu, Coordination Watpa, System Peloiban and ever. Masuk baca koi tuaning dia, masih thopa degi ni. Adik itu buat apa mana? Hayang hajik kita natna Manipur government nasina long term plan system amat tahu dia. Kuda mo ina harba matam da COVID lain nabi kita makta lanai gi school singida hospital no thui madu temporary ni hairi aduga government ji se lamboi khonang khong da ju on thori temporary ni hairi kaisu kaida dum goi bi hoba adubu long term gi damak ta khoina vision nama uba ta badi covid sina som chathadra leira basu covid lai chachi logi tarju chawgraba khumal la pa sida sanaroi singi hospital na khoi thamba pami.
Manipur Students Association Delhi MSAD has urged doctors to perform duty even during the hardest time. MSAD Secretary General Thokchom Singazit condemned hospital authorities in Imphal for neglecting non-COVID patients coming from other remote places of Manipur for treatment amid the COVID-19 pandemic. He said MSAD is saddened by the recent death of a 5-day-old baby at Churachandpur District Hospital and 20-years-old pregnant woman Kanpat Liukamai from Nonye District along with her unborn child. Singajit further added, let Kanpat Liukamai's husband Rosan Balan told MSAD that all the hospitals in Imphal, namely Jenims, Reams, Imphal Hospital, Raj Medicity and Shiza Hospital had ignored the serious medical condition of his wife who eventually died due to non-availability of doctors in the early morning of August 5 last. Singazit said more people with other medical conditions will die because of lack of medical attention amid the pandemic. He also mentioned that lack of proper medical equipment in hospitals across Manipur is one of the main problems faced by doctors and nurses.
Kayang kuina singi miyam na Imphal da layang ba kumthara kadori bano kayang kuina tampaki kun miching na Imphal da layang ba kara kadori bano sanjau paiba sing government hospital sing na neglect tobirek labasu sanjau paiba sing gi damuk da layriba private hospital sing na layang bigani covid-19 pandemic matam asida lairaba sing gi maraibak nongmagi mami samlakli lairaba miyam di sirasu yarabra hospital sing na layang driba naba hatpa lepu.
Nungba Area Village Authority Association today said that the rapid rise in COVID-19 positive cases among the Assam Rifles, Territorial Army, CRPF and Manipur Police, including IRB on duty in the state, has posed a serious threat to the people, including general public of Nungba areas. Most of the villages in Nungba areas are settled along National Highway 37 and hence they face threat from the COVID-19 pandemic. Nungba Area Village Authority Association in a release appealed to everyone to follow the COVID-19 protocols laid down by the government. Volunteers of All Andhra Youth Club Association, All Andhra Government Employee Association, the Eastern Scheduled Caste Students Union Andhra, Andhra Panalau Sangh and All Andhra Mairapaibi Association today caught two individuals coming from Kasom Kulan under Kamzong district in two Maruti Alto cars with registration number MN01 AG 5320 and MN06 LA 8512 along with 1,500 packets of illegal wind cigarettes worth around rupees 5.4 lakh at Andhra Kunzin in Imphal East district in the wee hours. The arrested have been identified as Mohammad Atik, age 21 years of Kiamgai Awang Laikai and Buyamayum Aboy, age of 24 years of Hyangthang Palak. The report said Kada along with the volunteers of the Andhra organizations destroyed the seized items at 10 a.m. today. A team of Imphal West Police Commandos seized a huge quantity of illicit foreign liquor from a residence located at Thongzu Part 2 in Imphal last night. Reportedly, the liquor was recovered from the residence of Thongam Mema Devi, age of 45 years. The liquor was later disposed on the spot. As a part of the ongoing drive against sale and consumption of alcohol carried out by Imphal East District Police, an awareness program on the issue was held at Andhra in Imphal East today. District Superintendent of Police Jogesh Chandra Haubizam along with representatives of Andhra Makhalekai, All Andhra Youth Club and residents took part in the program. The participants during the program decided to ban selling of liquor in Andhra Makhalekai, Maihopam and other surrounding localities. As a part of the anti-drug and intoxicant drive by Bishnupur Police, a police team busted illicit liquor brewing centers run by 8 individuals at Tera Khongsangbi, Laimaram, Kuno and Khudekpi under Moirang Police Station within Bishnupur district yesterday. The police team recovered 1,000 liters of local liquor along with raw materials and tools used in brewing illicit liquor. According to our Bishnupur correspondent, the corps later disposed the seized items at Chote BDF headquarters in front of media persons. Bishnupur Superintendent of Police Priyadarshini Laishram said that under a gazette notification, Bishnupur Police has intensified the anti-drug and intoxicant drive in the district.
Sigi akogi liquor gi mathata khoina chakhriba drive se yu gi mathata chakhriba drive se khare hena so intensify to ba darkar lei haibasigi wakhlonda akoina ngasigi drive se chakhajabani se we really mean it haibadune khoina haise don't do it to biganu si se adoga amuka haure amuka lakani same thing noi de hena maji tongadra bhagadra haraga hena mangjabagi pot oigani habasine. This is what we want to send out. This is the message that we want to send out to all these people who are indulging in this business.
Thingel Maru Women's Development and Welfare Organization appreciated Jenim's Dr. T.H. Uthan for his tireless service in treating COVID-19 patients. The organization, in a press release, prayed for Dr. Uthan's strength and courage so that he can carry on with his selfless service. The Kabui Mothers Association Manipur Kama said it condemns in the strongest terms the incident where a young expectant mother, Kanpat Liu Kamai, age of 20 years, wife of Roshan Balang from Puichi village of Oktang under Noni district, died with her unborn baby on 6th of August after being denied medical attention for delivery in several hospitals in Imphal. Kama, in a press release, demanded befitting punishment against the hospital authorities and sought justice for the victim and her family. Villages Council Longmai Area VCLA has strongly condemned the denial of medical attention by hospitals in Imphal to Kanpat Liu Kamai of Puichi, Oktan village under Noned district, a pregnant woman who died with her unborn child on August 6 last. VCLA, though a press release said that the denial medical treatment to Kanpat Liu was an inhuman act and urged the authority concerned to deliver justice to the deceased and her family. Under the aegis of social worker Dr. Alishan Abonmai, the Chingtam Women Development Association Manipur, in association with Kamranga Muslim Youth Club KMYC, distributed essential commodities to around 100 Muslim households at Kamranga village in Jiribam district today. The aid was extended to help ease the hardships of the local residents amid the lockdown and also to strengthen the bond among different ethnic groups in the state, the organization said.
Jiribam Chingtam Women Development Association amasung Dr. Alishan Abonmai nakut samnaraga kapan suba Jiribam da tingban pibagi maramna jiri praja akhona hara thagachari amasung matung da su Jiribam da adugumba tingban pini habiga khoi asa thamjari
aji COVID-19 awa jamna awa ba matamda tingbang bire hanna thagachari matung da su awaba taba matamda moise hanna mating tawgani aina haijari ekoi mayam ke torop taki moi wo hanna thagachari.
Again, we have a short commercial break. Stay tuned.
Lana Thoram Manipur University da matam sang na chowkidar oiramba Thoubal district ki Khangawok part 1 khulakpam laikai da leiba Karam Gangana hokiba August ki tang taret irai numita punsi sintha loiraduna Mapugi Laikolda Changzakray. Lakliba August ki tang taramathoi Thawan gi kunithoi ni panba Leipak Pupanumita Mangani Laihun Tamjaraga. Lakliba August ki tang tarataret Thawan gi kunipani panba Ningthokapa numita Lana Thoram Pangthok Jaragani. Hariba Thoram masi COVID-19 gi lockdown amasung curfew leiba maramna supna gi maming tagi oina Pangthok Jaragani. Masida laikhidrabaga loinaramba marup mapang khwai pumnamakna warau bidanaba nulukchari ba karam ongbi bina laima amadi macha masu sing khangabok khulakpam laikai.
Khanghanjaba Malem Sinba Thungna Sandorokliba COVID-19 Laichat Namaram Oiraga Ana Laying Sangda Kudong Chadaba Mayam Ama Mayok Naribasi Karadang Oirabasu Kok Nabagidamak Lamjingba Hospital and Medical Research Institute Private Limited na Chayol Kudingi Yumsa Kaisa Numita Appointment Lauraba Patient Gi Oina General Surgery Obstetrics and Gynecology Amadi Psychiatry Gi OPD Yengbagi Kudong Chaba Leijaragani Appointment Laudaba Singi Oinadi Kudong Chaba Si Leijaroi Mangzaunan Appointment Lobinabagidamak 8258967890 da contact tobiro. Khanganjariba Dr. R.K. Kumarjit, Medical Superintendent, Lamjingba Hospital and Medical Research Institute Private Limited, RIMS Southgate near Kombire, Keitel.
Welcome back. Taking preventive measures against COVID-19, the Students' Welfare Committee (SWC) Tongzu Phaizaleitung today organized a mass sanitization drive in areas under the jurisdiction of the committee. Students' Welfare Committee Secretary T.H. Nautomba urged everyone to follow the COVID-19 Standard Operating Procedure (SOP) in order to keep a check on the spread of COVID-19. He added the sanitization program will be carried out every week in all places located under the jurisdiction of SWC.
Laikaisidagi thokhiba amasung jathiba chatok sin tawriba mi singasi akoina sanitize tawjabani sanitize tawraga halakpa chatkiba khudimak se sanitize tawraga akoina thajabani ado aigumba masi akoina hapta khudingi hapta amunda nongma amumu akoina tawjagani.
Athokpam Apunba Club Committee AACC, an umbrella body of 7 local clubs in Athokpam area under Thoubal district, has sought immediate attention of the authority over the constant rise in COVID-19 positive cases in Thoubal district on a daily basis. Expressing grave concern over the development, AACC convener Akoizam Jiten urged the higher authority to detect the causes of spread of coronavirus among people who have no travel history. He underlined on the need of the district administration to initiate immediate preventive measures in containment zones. He claimed that no preventive measures have been taken in containment areas in Thoubal district so far. Jitan also demanded mass COVID-19 testing. He also demanded the authority to check the quality of PPEs provided to the doctors and staff at Thoubal District Hospital, as the number of positive cases is on the rise among health workers in the hospital.
Matamda koi matam yamna lori ba test tawjarga ha ju test taw ngamdriba si akoina kit machine hankatpiduna thuna tawbina so government mai ka chingchanjari loina Thoubal district hospital da thamliba staff sing da sijanariba PPE gi quality si koi government check tawbiduna sigumlaba hoji government doctor yauna staff sing paktakna positive oirakliba sida government PPE sing si check tawbina so hajari.
Condemning the Manipur government policy of only 1,000 rupees remuneration hike for Village Defence Force VDF, Sendra Outpost BDF personnel today staged a protest in front of the outpost in Bishnupur district. Initially, the honorarium paid to VDF personnel was rupees 9,500. The state cabinet recently announced to increase it to rupees 10,500. However, the 10,050 BDF personnel in the state have rejected the mega honorarium hike. With an aim to help the public and farmers in Manipur in fighting the COVID-19 pandemic, Lemlei Agro and Food Industries Private Limited Moirangkom Imphal West has decided to buy products of local farmers which will be delivered to the consumers in the state at the right price. Through a press release, Lemlei Agro and Food Industries Private Limited informed that the selling mode will be door-to-door delivery system. The mobile shop of the company will arrive at the buyer's doorstep. The company also urged all to maintain COVID-19 protocols while receiving their agricultural products at their doorsteps. Any farmers can contact the company at 886-125-5360, the release informed. 109 Battalion CRPF in coordination with Satrughn Kumar and AK Singh, Chief Advisor, Mongsangai, distributed 5 kg rice each to 80 beneficiaries today. The team also organized a sanitization program during which houses in Mongsangai area were sprayed with disinfectant. Commandant 109 Battalion CRPF Binod Kumar urged all to maintain utmost hygiene and seek immediate medical attention at a designated hospital in case anyone is feeling unwell. Deputy Commandant of the battalion Binod Sawant, Inspector Sukhbir Singh and Jawans of the battalion conducted the program by maintaining social distancing and other precautions of COVID-19. Under the guidance of Thoubal District Superintendent of Police Dr. S. Ibomcha Singh, representatives of Thoubal District VDF Welfare Association, along with Sub-Divisional Police Officer Yairipok K. Dhananjoy Singh, Officer in Charge Yairipok Police Station, Muhammad Riyajuddin Shah, extended a monetary aid of Rs 1,50,000 to Kaisam Ongbi Lirva Devi, wife of late Kaisam Akash Singh, a BDF personnel who passed away on July 21 last due to an illness. Lamlai Block Congress Committee today distributed edibles to 43 households under containment zones of Lamlai constituency. The aid was extended under the guidance of MPCC co-opted member Choibam Diben. A sanitization drive was also organized at different places of Lamlai constituency. Ngairangbam COVID-19 Task Force has been conducting sanitization drive in Ngairangbam area as a preventive measure against the coronavirus. Local club volunteers along with the task force sprayed sodium hypochlorite at Ngairangbam Makha Laikai, Awang Laikai and Maning Laikai, besides distributing face masks and hand sanitizers to the residents. Dozens of local residents rushed to the airport in Kerala's Kozhikode yesterday as they heard a terrible thud after the Air India Express plane overshot the tabletop runway at the airport and fell into a valley 35 feet below. 19 people were killed and more than 100 injured when the flight, which was coming in from Dubai with 190 people on board, overshot the tabletop runway while landing in heavy rains, fell into the valley and broke into two, according to media report. Captain Deepak Sate, the pilot in command, and his co-pilot Akhilesh Kumar were among those who died. The 59-year-old Sate was a former wing commander of the Indian Air Force IAF and had served at the force flight testing establishment. People living nearby brought shocked passengers out of the Boeing 737 aircraft even before first responders could reach the airport. Small kids were trapped under the seats and it was such a distressing sight. When we reached there, some were deplaned, a local resident was quoted as saying by PTI. Television footage from the accident site showed the aircraft split into two pieces and the debris lay scattered on the ground. Another man in the rescue operations told a television news channel that the injured pilot of the aircraft was taken out from the cockpit after breaking it. India has formed an expert committee comprising representatives from all relevant ministries and institutions to oversee all aspects of its COVID-19 vaccine plan, from identification of the vaccine to buying to financing, the purchase to distribution and administration. A move that comes even as 6 vaccines are in phase 3 or combined phase 2-3 trials as countries around the world scrambled to strike deals with multiple vaccine makers, a media report said. According to people familiar with the matter who asked not to be named, the panel will be led by Niti Aayog Dr. V.K. Paul and co-chaired by Health Secretary Rajesh Bhushan. It will pick the vaccine or vaccines that India can use, plan the finances for what is sure to be an expensive purchase running into billions of dollars, and prioritize the sequence of administration. In the absence of a vaccine or a cure, the only way to slow the spread of COVID-19 has been wearing face masks, wearing social distancing and restricting regular activities, things that have taken a toll on life and work. Till Friday night, the coronavirus disease had infected 19,38,592 people around the world and killed 72,053. In India, the corresponding numbers are 2,83,835 and 42,566. Before we wind up, let's look at the top news headlines once again. COVID-19 death toll rises to 11. Total positive cases stands at 3,466. India coronavirus numbers rise in recoveries, growth in active cases drop. NU CM opposes final Naga political settlement at cost of territorial boundary. And with that, it's a wrap for this evening news bulletin. Thank you for joining us. Good time ahead.